Here.
Thank you. Welcome everyone to our Cohort 2 Professional Development Technical Assistance time. I hope you are all enjoying this rain that we're getting. We need it so badly. Just want to review the agenda for our time today. We have Paula Gravel and Colleen O'Neill here to present fiscal information and answer your questions regarding anything fiscal. I will then do a very short presentation. Last time we met, we went over the child outcome summary, or the COSE. And so today I'm going to share information on how we are going to be asking you to report that to us. So there's a spreadsheet. I have a very short presentation for that. And then we have time for Q&A for today. I know that we kind of ran out of time last time, so we wanted to make sure that we provided that today. We had time for that on our agenda. So with all of that being said, I'm going to turn it over to Paula and Colleen.
Good afternoon, everyone. So that means I should speed through all of the slides, right?
No.
On the funding. So for those who don't know, I'm Paula Gravel. I'm the Director of Public School Funding here at the department. And Colleen, I'll let you introduce yourself.
Good afternoon. I'm Colleen O'Neill. I'm the Assistant Fiscal Director for the Aussie team.
Thankful that Colleen could join us today. Barbara is away this week, so Colleen is filling in and helping us out on the areas that they are the experts in, which so I'm just going to kind of walk through some of the slides, and then when it's time for Colleen to speak up, she can take over. Unless you want to do all the slides, Colleen. No,
Nope, go right ahead.
All right. If you're sure, I don't want to take it away from you. So before I get started, I just want to thank you all for being part of this amazing venture that we've all taken on. I think it's the first year we've already seen improvements in services for children that hadn't been able to get them, and hopefully they're getting what they need so that they can excel in school going forward. So I just want to thank you all for that. I also want to thank the team, both at CDS and here at the DOE, for all the work that is going into this. It's a lot of work, but you know what? It's worth it. So I'll just start off with that. No, I'm not running for office. I'm just truly thankful. But I do have to say something first before we continue with how the funding works, because there's something very important right now that is happening that until you can't get funding until it's completed. And that is the October 1 collection of counts. There are a significant number of SAUs that are in the cohort that have not submitted their Cohort 1 counts yet. And they were due last week. And we can't calculate your second quarter funding until we have that information. It's a spreadsheet, and it comes back to Jen Hopkins, and she has reached out to many of you already. The responsibility for filling the spreadsheet out, who does it belong to? It depends, but ultimately, I would suggest the special ed director is working with the business manager and your data collection person, if you have a data collection person. So please, I'm begging you, because I want to send you money, but I can't until we have those counts. Okay? That's it. Just a little side note before we start. Now I'm going to share my screen and get into the presentation. So now that I talked about wanting to pay you, how does that all work out? So here's the agenda that we're going to speed through for this presentation, piece of it. Real quick, the legislative background, I won't spend a lot of time on that. Then we'll get into enrollment, which actually was last week's presentation, or 2 weeks ago, I forget now, time flies, presentation. So I'm not going to spend a lot of time there. That was Kim Hall and Allie Cookson from the data team. And attendance for children attending a location off-site. But really what we're here to talk to is about the data and the financial collection schedule, the quarterly allocations and calculations, and the documentation requirements for allocations and then reconciliation. As you all know by now, I hope, this is 100% funded by the state for pre-K enrolled students that have an IEP. And so that means it does not get funded in the other funding model, which is called essential programs and services. It's completely separate. That's why this collection of data is separate and why we have quarterly calculations of funding. The other process of funding, EPS, essential programs and services, always has a state and local share. This is state share only, no local share. So it's extremely important that the documentation that we're about to discuss is done as noted, okay? So again, I think you all know why this transition is happening from CDS to SAUs. It's a matter of having the services available, and it's transferring the responsibility of who's overseeing that. So I'm not going to spend any time on that. We know that the legislation was enacted, LD 2214. This is the second year of a 4-year transition period. By the end of the fourth year, by the fourth year, I should say, every SAU will have to be part of this transition. So thank you for being part of the second year of taking it on. That helps us all in getting out the bugs. Let's put it that way. And there have been bugs. We're not going to lie to you. There have been a lot of bugs, but with your help, we're working through them, and we're gonna make this into a well-oiled running airplane. We call it an airplane because last year in Cohort 1, we were building the plane while we flew. It's built, but it's a little choppy still, so hang on tight. And yes, I think I'm funny, and I do try to keep the fun in funding. That's my hashtag. So, but if you don't find it funny, I completely understand. All right, so here we are, enrollment counts. This is how we calculate funding. We will collect counts 4 times a year. The first day of each quarter. July 1, we've already collected those. October 1, I just talked about those. We need them now so I can send you the funding. If I don't get the counts for October 1, I can't send you funding. And that's going to make you sad. And again, keeping the fun in funding. Sadness does not work. And then again, we'll do it in January and in April. Need all of those. And I will remind you all, July 1, even though when we get to July 1 again, the year's over, right? The new year's beginning, we still need July 1 counts. So please don't go home in June and forget to do that, because this is a year-round process, and that's really important, okay? So you are also entering enrollments into the state information system. That is working with Allie. Allie is here, and she's putting some information in the chat already. I appreciate that. Allie and her team over on the MEDMS data support team can help you with those enrollments if you have questions. But we are still also collecting through Jen Hawkins the spreadsheets. We hope to get off the spreadsheet eventually, but for now we need to do it in both ways in order to properly ensure that we're getting everything we need. So this is for 3, 4, and 5-year-olds that are enrolled in your pre-K program with an IEP. And then also those that are considered in Child Find, you will receive funding at $1,000 per child for those that are in Child Find, that you have a signed parental consent to evaluate. If they're in Child Find, but you do not have a signed parental consent yet, we cannot provide you the funding for that. So that's very important. So if they're in Child Find, that means they haven't been evaluated yet, and we don't know if they need an IEP yet. Each quarter, this is why we collect quarterly, more can become eligible. More children become eligible for these services as their birthdays come and they become a certain age. And that is not my area of expertise. That's Sandy Flack, and she can fill that in later. But when they become eligible and they are referred for services, I'm learning a lot of terms. I was not a special ed expert, so please bear with me. Then they would be on Child Find. We will give you money to help with those evaluations. And then after the Child Find is done, if they do have an IEP, the next count we collect in the next quarterly count, they would be on your regular count for regular funding and no longer on the child find count. The child find funding is a one-time fund for per child, $1,000. Some children you might need, it's unlikely you're going to need more than 1,000 is my understanding. That's an average cost for evaluations. So it should cover
Oh my God,
everything.
that's ridiculous.
Excuse me? Oh, sorry, Christine. Thought you had a question.
No, I was just saying that's really low, but I should mute myself because
is it
that's
low?
not.
Tell me.
Oh, it's very low.
Help
It's
us
at least,
learn. Help
oh,
us learn.
it's very low.
Okay.
An evaluation in one area probably costs, with all of the adults who then sit at the table to conduct that meeting,
Okay.
probably at least $2,000 to $3,000
Really?
per
Okay.
area.
So here's
of-
what we're going to do, Christine, because you said that. I'm glad you weren't muted. I appreciate that. We
Oh,
are
sorry.
learning. No, I'm glad. No, I'm not. I'm serious. We need to learn that we're still figuring things out. And so, and other people are agreeing. So it's good that you spoke up. I'm glad you did. So we are learning. And so I'm going to ask Sandy and Jen to kind of make note of this so that we can come back to you and look at, we got that from another source when we first created this last year. We didn't have anybody come to us and say that wasn't enough last year. But if it's not, we want to know. And so, because we can correct this, okay, as we go forward. But if we don't know, we can't. So thank you. I'm really glad you said that. For now, this is what we have.
Okay.
But I hope that I'm sure Sandy and Jen and her team can reach out to you and others that are mentioning in the chat that they agree that that's a low number. We want to be able to, again, this is 100% state funded. We don't want you to have to fund anything at the local level for this. So if we're not providing sufficient funding, we need to know.
And
So thank
Paula,
you.
Pauline might be able to speak to this as well, but that is something that they are reviewing on their end when SAUs are demonstrating where they are spending their money. Pauline and Barb and their team are reviewing that so that we are ensuring that our funding model is accurate. And Pauline, I don't know if you have more to add to that.
No, that's exactly right. So when we are collecting our data, which is a detailed trial balance, and we're comparing the all of the expenditures that go through that, and then look at the upload to the MAPS Neo system, we're doing this sort of triangular calculation of looking at where those funds are being spent, in what categories. Is it reoccurring expenses? Is it a one-time thing? And truing up those numbers to see if we're close to what your allocation is, if we need to allocate more, if we need to back down a little bit. So that is all data that we're collecting to look at as well.
Right. So the first year, and all of the money that you get, we're assigning 1,000 for evals, okay? And maybe that hasn't been enough, and they are reviewing now everything that we've collected over the first year. This is why, and I know we've had a lot of maybe disgruntled staff about the quarterly uploads that we need for the expenditures, but that's why, because we can't determine if we have even calculated enough for funding as a baseline without that real data, which we didn't have before. So that is why the collections, and we'll get to that in a few slides. So right now, the formulas that we're using are based on our best guess. Okay, and we are going to refine things as we get the data in and as we review. And if any district, last year, for instance, if any of the funding we provided for the year was not sufficient before the end of the year, we would have provided them funding to bring them whole. And it's the same here. If you are not receiving enough funding to keep you whole with what we're giving you for an allocation, we will provide more in the same year. This is not a reimbursement model. It's very different from what I think most of you are used to in billing other systems. This is a pay ahead model where we collect who your counts are at the beginning of the quarter, the first day of the first month. we calculate an allocation of funding and give it to you within that first month of the quarter. So we're not saying you have to spend it and show us your expenditures first and then we pay you. We're paying you based on what we believe is going to be sufficient amount on a formula that we've created. And then if it's not, you come back to us and work with Colleen and Barb and myself. And if you need more funding, we will provide it. Okay, I'm going to keep going. I'm hoping that Sandy and Jen are kind of watching the chat and answering things as they come up. I saw somebody ask something about 676 kids, which I don't know what that means. So
I answered it in the chat.
okay,
Yes.
great. Thank you. I'll keep going because I don't want to take too much time and miss the Q&A, which we're kind of having Q&A as we go, which is fine. I like that. I like that model. This is just a slide that talks about the minimum data elements to do the enrollment for the students that you need to get from the parents. Attendance for off-site students. This is how you would enter them into the enrollment system if they are attending an off-site location where you are paying for services. You would create a special classroom in your local student information system and record it as present remote. If those words don't mean anything to you, reach out to Allie Cookson and she'll help. All right, the data and financial collection piece. So each quarter, we need the child count. So I just talked to you about the October 1 child count, which we needed by yesterday. And there's a lot we're still missing. The detailed trial balance, we need by I'm not sure these are lined up right. Yes, by January. Okay, because we're in the second quarter. Sorry. So we need your first quarter detailed trial balance and your quarterly expenditures uploaded into MEFS by the end of this month for the first quarter. So talk to your business manager to make sure that's done so that we can review the expenditures and the revenues and ensure that you're getting enough. Quarter 2, we're going to need by January 30. So you have 1 month to provide these financial documents after the end of each quarter. Okay. Again, I understand that could be tight, but hopefully throughout the quarter, you're putting information in. And so it won't be too difficult to get that information so that we can ensure you're getting the funding you need. We have no other way to do it. Allie, I see you have your hand up.
Yeah, I just wanted to clarify something. There was a question in the chat, Paula, about the October 1 date, and you just called it the October 1 child count. I know that some people maybe on this call are familiar with the October 1 enrollment report that is in NEO for overall student counts in the district. This is separate. This is a little bit different. So just be aware, so the due dates for the October 1 enrollment for the whole SAU are very different than what we're looking for here, which is why Paula is saying that they need to be in last week. So just be aware that there are two different purposes, and also 2 different funding streams that Paula is working with here. So this child count is different than the one that we're talking about on the data team for your overall SAU.
Thank you. Yeah, and Allie and I are both very much a part of both collections. And so there's this project, which is pre-K with an IEP, that yes, they need to be put into the system and we need the spreadsheet by yesterday. Then there's also the October 1 enrollment counts for everybody else, and that's part of the EPS calculation. And that is due by the end of this month in that system. 2 different things. Focus on this one first, and then you can focus on the other one, would be my advice, if you need to separate them out. Thank you for that. I also saw something. Okay, good. Colleen, you answered the trial balance. Everybody's doing so well. All right, so here are the people to reach out to for questions about the counts. Myself and Jen Hopkins. For questions about the detailed trial balance, Barb McGowan or Sarah McLaughlin, and Colleen also can be someone to reach out to. And then for the quarterly uploads into the MEF system, Maine Education Finance System, that's Terry Beal, or myself actually for that one as well. So that's how the data and financial collections are working for this project, for this program, which is a separate funding source and collection than the regular school funding source and collection that is also happening at this very time. They coincide. The difference is the other one is done once a year. This one is done 4 times a year. This is just an update on the transition status and enrollments for last year from cohort 1. You can see that over each quarter, those with IEPs increased. You can expect that to happen for you as well in cohort 2. In most cases, that's what we would expect to see. And so here's the good news. By the end of last year, in the 4th quarter, we had 309 students in our, I think there's 17 here, cohort 1 that were getting services that weren't before. What a blessing, right? So, and so this is really, really good. We should applaud. This is just something that I put together to try to help you understand whether they are considered in this program or not and how the funding works. If they're a pre-K 3-year-old, they're in the cohort, they're in a cohort SAU, then they get this funding. They have an IEP, they get this funding. Would they get funding for EPS subsidy? No. EPS special ed? No. So this explains whether they are considered EPS or if they're considered this program, the ESCE, I think everybody's calling it, Early Childhood Special Ed. I'm still calling it pre-K special ed, so I apologize for the difference. There are some that CDS is providing services for, and I believe there's now a way to pay for that, but that's also a Sandy Flack question. Sorry, Sandy.
I apologize. I was reading the chat. Could you say that again?
The CDS service, if children are now are still being provided services through CDS, there's a way to pay back CDS for that because we're funding for that.
Correct. Yep.
Okay.
There is a mechanism in place for that.
Great. We fund you and then you pay whoever's providing the service. Okay. Pre-K special ed coding. For this project, you have to use this fund and revenue code for any pre-K enrolled student with an IEP. Otherwise, it's going to get mixed into the EPS expenditures, and that's going to mess things up on the other side. And if it's not properly coded, you're not going to get 100% funding. It's going to end up messing up the state local share of EPS funding. So this is very important. There's a chart of accounts available on our webpage, and everything is in there. You have to keep it separate, the funding source for this program. The payments will be calculated based on the quarterly count collections. I talked about that a few minutes ago. They will be made each quarter. You've already received your payments for the first quarter, with the exception of 2 that were late. And if you're here, I'm sorry, but they've been processed. You should get them any minute now, any day now. But everybody received their first quarter payment. It was a little late getting out, so probably it was in early August. I would love to be able to process these payments by the 13th, which is a holiday. So let's go with the 14th so that you receive it before the end of this month. But I can't process the payment until we receive all the data and make sure it's correct. The second quarterly payment may be more or less than the first quarter, because in October, if the first quarter which is more of an estimate, if the second quarter is less, then we will reduce it down a little bit, based on the second quarter counts. The difference is for the third and fourth quarter, we will never go lower than what your second quarter counts were. Even if your counts in the third and fourth quarter go down, we will never go lower than the second quarter for payments, so that you can at least have stability in your staffing and whatnot if just in case they go down. So we will never go down, but we will always go up. And as I showed you earlier, the trend is going up at each quarter so far. The calculation is based on the same EPS rates that we calculate for EPS for your district, which if you don't know what those are, that you don't need to. Just know that that's how the formula works. So each SAU has a different factor or multiplier dependent upon their SAU, okay? And what their EPS rate is, which is specific to that school administrative unit, okay? And then the rest of these calculations are how we determine for basically the general ed FAPE section. There's 2 areas of calculation of funding. Then we also take and add in the count times a 1.5% weight for special ed, also multiplied by your EPS rate. And then as I mentioned earlier, the child find is $1,000 per child. But all of this is under review based on the actual expenditures that we're receiving. And if we need to adjust it, we will. Again, I said earlier, it's not a reimbursement model. You do not have to spend it first and get it back later. This is a pay up front model based on counts times a formula. But then if you do end up spending more, we will make sure you get that funding as soon as possible within the same year, depending on when we receive the information and verify everything. Let's see, first allocation July. Pretty much already went over all of these things. Additional funding prior to the end of the school year if necessary. Reconciliation. Again, this requires the timely submission of the quarterly uploads into the MEFS system, which your business manager should be very familiar with the MEFS system and those uploads. I'm going to go ahead and let Colleen take over at this slide for now. And just let me know when you want me to move on.
Great, thank you, Paula. So again, so the reconciliation is based on the data that you submit with your detailed trial balances and in the MEF system. The most important piece to this is making sure they're coded to the correct fund code. We did receive early on some uploads where we didn't have any data in that 2213 expense fund code, so it was hard to determine what the expenses were. So that is the most important takeaway, to make sure that you're using the proper fund code for those expenditures. We also have a system in place right now that we're working in Grants for Me to track some of these expenditures. When we're comparing detailed trial balances to the upload in MEFS, we're making sure that expenditures and the revenue is consistent and recorded correctly. So we're looking at your staffing. We're looking at high cost out of district placements, high cost in district placements, supplies and materials. We're looking at reoccurring expenses or those sort of one-time expenditures that you're not going to have all the time, but or part of the startup of your program. And if we need to reach out for further information, or if you've gone through an application process to receive funds for a van or for some sort of construction project in your location, we may reach out for backup documentation on that, but we'll be in touch if we need that. And can you change the slide? We always kind of follow, even in IDEA, the reasonable and necessary. It's the same with these types of expenses. We're looking at expenses that are tied directly to students' IEPs. We're looking at expenses and what you would normally pay for these types of expenditures if in normal circumstances. We're looking at staffing, again, salaries and benefits, and making sure that you're recording any type of share of somebody mentioned their business manager or other staff that need to be included in these expenditures. Specialized equipment, assistive technology, specialized transportation, all of those items should be recorded and expended to the proper fund code so we can track them. Again, we're making sure to gather all this information to make sure that you're funded at the amount of funds that you need to run this program successfully. So we will adjust if we see that we're not allocating enough, and we may hold back if we've allocated too much. But again, it's important to get that data as quick as possible so we can then turn around and make sure that you're not waiting for your funds when you need them. Next slide. Oh. So the website for the early childhood special education, there's information there, there's resources and tools. There's contact information for everybody in the department that can help support you through this. And I will turn this over to Sandy. And I'm open for questions. I'll put my email in the chat if you have any questions. I am filling in for Barbara, which are very large shoes to fill, but I'm happy to jump in and help support however I can.
Thank
And
you,
you're
Paul.
able to reach out to me as well. Sorry.
Nope, I was just going to thank both of you for presenting this. We have been trying to keep up with the questions in the chat, but I want to make sure that if we have missed a question or the answer that we've provided is still leaving you with more questions, or you don't feel like we answered it completely, now is the time to raise your hand, unmute, and ask our experts here today what those questions are. There is a question about how long it will take for this recording to post. Thank you, Jen. You already answered that. There's a question about, it was recommended that we have time and effort certification for staff who are working part of the time with these students. To my knowledge, that's not something that we require for this.
No, all we ask is that you do a percentage of their time in like NEO staff if you have to have them there, but percentage of time for if they're working, you know, you split the cost per the fund codes so that the proper amount of cost, if it's a percentage or however you do it, is put into this system and then the rest into other systems,
Right.
other revenue streams. So no, time and attendance isn't necessary, or time, whatever it's called.
Time and effort. It's
Time
not
and
the
effort.
same that's required for other.
This isn't a
funding.
grant. It's
No.
not, it's especially not federal.
Okay,
So am I to
let's see.
understand when we're doing our special ed staff count, I can't remember what the EFS, whatever the number is for NEO, that we need to separate out the staff that are doing 4-year-old stuff. So any of my time would be a certain percentage of whatever that I need to count separately in NEO.
Not in NEO staff, you don't have to split it.
Not,
No.
okay,
NEO staff is only if you have staff that are doing some special ed and some regular ed or general ed.
okay, great,
That's
thank
the
you.
only breakout there. It's the expenditures in the uploads of financials that you need to split it. If there's some that are doing for this program using this revenue and fund code, this fund code, or others doing it not within this fund code.
All right, thank you.
Yes, sorry for the confusion there.
I will say we had some districts in cohort 1 that did that on their own. They did a time and effort kind of study at the beginning to figure out how much time they needed to bill to the early childhood special education fund, just because they were not sure and they wanted to make sure that it was accurate. But that was their own process that they chose to do for that. Any other questions for our fiscal team?
I was wondering how the invoicing piece works with CDS when they're providing services? How does that work? That for us to get invoiced for that?
Yep, we do not have Dan here today, so I will do my best to try to explain it, but you will receive an invoice and then you will pay CDS for the services that they have provided. And then you will turn around and you will show that invoice on that expenditure on your trial balance.
And how is that? How often are we invoiced? Is that a monthly? Is that a quarterly thing? How does that work?
Monthly.
Monthly? Okay.
Yep. So I'd imagine that those will be going out shortly if they haven't already gone out. Christine?
So I have a question about like the CDS supervisors and those folks that are in the meetings and such, and case managers. Am I paying for that time?
Yes, that's part of that MOU where you school districts have said we need the following services to help support us this year.
Mhm.
And we've articulated it in the MOU. And then on the CDS side, they are keeping track of the hours that they are spending working for each district.
I see.
There is a rate sheet. The cost is based on that rate sheet. You'll be billed for that.
Okay.
You will be paying that out of the allocation, out of the funds that you have already received. And then you are then also showing that in the trial balance. And please, anybody from CDS, correct me if I'm wrong, or DOE. Got it.
So maybe this isn't the right time to bring this up, but I have had other conversations with providers who have written more medically based IEP because they've been billing Maine Care. And so there's been interesting conversations about writing certain accommodations and checking certain boxes in order to get paid from Maine Care. And then if those boxes aren't checked, they won't get the same kind of funding. And maybe because I'm wearing still a lot of my Massachusetts understanding, I'm new to Maine. That's been kind of a new learning for me, and definitely sort of falls outside of our box of what education looks like. And I didn't know if you could speak to that a little bit.
Yeah, I'm definitely not the expert on this. I know Erin Fraser is though, so I'm going to turn it over to her to answer that. She is our Maine Care guru.
Yeah, Maine Care guru.
Yeah.
So CDS does have a very medically oriented IEP because we do billing for Maine Care to try to recoup some of the costs of preschool. However, when you develop an IEP, you don't consider, as you know, the cost of anything or how anything's going to get paid to write your IEP. So if you have specific concerns, Christine, again, a school does kind of have a different bit of a perspective from CDS because it is a standalone special education system that has that kind of medical framework for special education, different than a school. It doesn't, so just understand that that is what is coming toward you in terms of an IEP, but you should just be developing your IEPs for, what the services that are required for kids, which CDS does as well. Their data program, their student information system, requires a lot of medical formatting to write that IEP based on how they bill.
Yeah, so
I feel
then
like I might have just confused you.
should certain things still live within CDS for these kids and not? So how does that work? I don't understand that.
Can you tell me, are you doing 4-year-olds and 3-year-olds?
Yes.
Okay, so the IEPs should be adjusted to your student database, whatever you're using for your database, if you're using Acuity. And so
Okay.
it would be your IEP, you're taking ownership for that IEP, and you're writing that IEP based on the requirement of the child. So if it does, it's not unusual for the IEP to look, not like substantially different, but there might be some differences, some subtle differences in that IEP, but you should be taking ownership of the IEP and putting it in the way that you want it to be conveying the services and supports needed for that child.
Right. So for example, we don't in education use the terminology 3-to-1 or 2-to-1 or 1-to-1. That is like, we may say child needs additional support, right? And
Yes.
yet that terminology seems to be necessary for other settings.
It's only necessary for CDS because of payment. So you can, so in terms of, that's how CDS has approached the 1-on-1, 2-on-1, 3-on-1, and 4-on-1, is because they're navigating what the cost is to the provider of that service. But when you are in a school environment, that's not how schools think of staffing ratios. So you can
Correct.
go ahead and make that adjustment on your IEP because that is no longer kind of relevant.
Okay. So I'm sort of blowing up the minds of a lot of people around me, and they're not happy. I mean, I don't know if they're getting enough information about what we're doing, but when I come in and talk about this stuff, my community folks are, they're not thrilled with me, and I look like
You're talking about your private providers?
well, let's just say, community providers. Let's not call anybody out too much. We are being recorded here.
Well, I'm just trying to understand if it's your mixed delivery system or within your school. Is it your mixed delivery system you're referring
Yeah,
to?
yeah.
Okay.
I mean,
And I would
yeah,
say that since 1982, the mixed delivery system has been looking at IEPs that way. So it would be adjustment for them to understand that as well. And there are different rates of pay in the mixed delivery system that have been associated with those costs. So that could be, but maybe what you could do is potentially have a meeting with Dan and the site director in your area. Where are you, Christine?
Oxford Hills.
Oxford Hills. So that would be
Stacy.
Stacy, and Dan should meet with you and just kind of maybe help navigate that a little bit. It is kind of a factor of, unfortunately, the sync system has limitations because it is a billing system more than it is an IP system. But because of that, there's been a lot of confusion about that kind of thing in particular. But I think it's just navigating the new horizon of that and how that works for people. But they probably having a conversation with them, with Dan and Stacy would be great, just to kind of help understand how that might work.
Yeah. Okay. I don't think that Stacy has a problem with that. I think it's, as that sort of filters through various people and then private providers. And so it's just been challenging. And I
Yep, it
think that
is.
it's, people that are, not on the upper ups that are in the challenges. And I'm, like I said, I'm coming in with this Massachusetts perspective and trying to shed that and to understand Maine and understand this approach from this medical model that has lingered to the special ed model. And it's difficult, it's challenging, and to
We are
write
all
an
challenged.
IEP
Yep.
from an educational perspective, and then in a place where people are looking at funding, it's been challenging.
I think, Christine, one of the takeaways I'm taking from this conversation is that there's more work that we could do with our mixed delivery system partners to help them understand how those kinds of ratios aren't really considered in educational environments, in schools.
And right, and maybe tell them how they can still get their money from Maine Care. Like, I don't know how they're still gonna get their money when somebody says to me, well, then I'll bill you the school. And I'm like, No, I
Yeah,
don't know.
well, main care is, again, um, let's talk offline about this. This seems like a little bit of a more slippery slope of how another complication that is added here is that some of our private providers are billing main care directly.
Yeah.
And, billing for educational staff, like a one-on-one, is not something that is, you have to have a day treatment level support or Section 28. Those, again, are day treatment level support, BHP. That's all Maine specific jargon. And it's also only related to Maine care and not IDEA or MUSER, right? So
Right,
it's
right. That's
important
that's
for,
what I'm talking about.
yeah, so it's important for us to make sure that we kind of help everyone understand that everyone is going to have the appropriate fiscal support. They also are very new, Christine, the special purpose preschools are very new to daily rates. And so sometimes there's some confusion that they feel that, they don't understand that the daily rate is going to pick up any expense that they have, so they don't have to incur it. So anyway, in all of those things
Oh,
are very complicated. And Christine, they're like 2 years new to our state
okay.
since 1982. So that's why you being new to the state, this is very ingrained, but it's a
Sure, sure.
challenging coordination because, again, the system has been operating under this certain pretext for so long, and so we're trying to all navigate this. So if you have trouble, the best thing to do is to engage Sandy and Dan and to try to work this out. But I think, again, what you've highlighted for me is that we need to do more work with our mixed delivery partners and understanding the whole main care billing part of this. So thank you for bringing this to our attention, because I'm certain that many other people are, as they're navigating a mixed delivery system, are going to be dealing with some of these things. So thank you.
Thank
Yeah,
you for your
that
time.
that's great feedback. We are meeting with CDS contracted providers and early care and educators next week. So that might be something that comes up that we can help clarify. So I've already added it to my list. So thank
And
you.
if you need support with a partner, certainly CDS has been working with that partner a lot longer than we have in schools. So CDS has information and support that they can provide around, approaching that as well, and can, collaborate with you on having a discussion with that partner as well.
Okay. I want to be mindful of the time. We have 10 more minutes, and I want to, in a second, share my screen. I'm going to be going over the COAS data reporting. So last time we met, we went over the COAS reporting. And I think during that time, we mentioned that we would be asking for you to report those scores. So then everybody started to ask about how do we report those scores, which I love that those of you that were attending and listening really wanted to know how to do this. So I have a little presentation to share with you on that. Just know the reason why we always do some sort of PowerPoint presentation is because we then post this recording and the PowerPoints on our website so that people can refer back to them for the information. So if you missed our last meeting where we went over the COAS reporting and you're sitting here thinking, I don't know what that means, this will be a little confusing. So make sure you go back and watch that recording, or you reach out to one of us so that we can help walk you through that. And Jen just posted the link for the website in the chat as well. So I am going to share my screen. Okay. So last week we talked about the child outcome summary reporting. And so I want to talk to you a little bit about how you are going to be reporting those scores that you come up with. So you will be receiving a spreadsheet from us that has all of your your students' information in it. And if they transfer to you from CDS, it will have their entry COAS score that CDS did upon entry into their system. So each school district is responsible for collecting this score on students that enter into Part B 619. So that's that early childhood special education. And then when they exit out of Part B 619. So that could be during that, as they exit to transition to kindergarten, if they exit because they moved, exit if they were dismissed, you'll want to collect that. If they exit because they moved to another school district, we're working on how that we can also transfer those COAS scores to go with that child. So you will be sent that spreadsheet with the child's information filled out, and if they came from CDS, that entry COAS score. It will be your responsibility to obtain and enter the entry COAS scores for any child that does not have one. And when they enter into Part B 619. So once they become eligible for an IEP, as we talked about last time, that's when you would go through that process to obtain that score. This is somewhat what the spreadsheet looks like. And here in red is where you will be entering those COAS scores. Well, not the COAS scores, but the did they make progress? And I'll show you that on the next page. So you will be looking at, is the child showing age expected functioning across settings and situations? And that is per outcome on the child outcome summary. So you'll see here that it has the student's name, the date that they got their entry COAS score, what that COAS score is, and then what you will be responsible for in the spring for children entering kindergarten is their exit COAS score. And I'll go to the next page. So as you can see, and if you cannot see this on your screen right now, you will get a copy of this PowerPoint. But as you will see this, we showed an example that on these dates in May, the school district did the exit COAS score. They rated them, and then they also had to toggle whether the child made progress or no. So what we're looking for is, is the child making progress on these scores between entry and exit from Part B 619? So these are the areas that you will have to fill out in the spring. So once again, you're looking at that entry rating here. And then you are also looking at the exit rating. So this one, the child started as a 2. They exited at a 4. And so did they make progress? Yes. Oh, there we go, 4. And then once again, yes. One of the things that we've done, and we talked a little bit about it last time we met, is that we have built training modules into our state of Maine learning management system. It's called Engine. And so we will be sending out an email to all of you, to our contacts at each SAU, where you can sign up to get onto this learning management system and go through each of the modules that will teach you more in depth about the COAS. And that's how you obtain the scores. So the feedback that we heard is that you all wanted more information on how to do this. And so we have entered all of this into this learning management system so that you can easily access it at any time. You can, if you are having your pre-K teachers help you, your special education teachers help you, they can all take this. People that participate in the modules will have a short quiz, and then they can collect contact hours as well. So that email will go out, we're hoping by next week, for you to sign up on this platform, and then you will be able to access this module training. And that is all I wanted to say about the, oh, let me stop sharing, about the COAST data collection. So you will be getting those spreadsheets sent to you shortly. I would advocate that as soon as you get that email to sign up for the learning management system and participate in those modules, as well as any team member who might be helping you obtain those scores. Any questions about that? I quickly went through that. And I know we're always hopeful on our agenda to have lots of time for Q&A, and here we are, we have 3 minutes left. So I want to make sure I give anyone time for any lingering questions that they might have about the fiscal part, the COAST scores, or any other questions you might have.
So Sandy, I've been working on our October 1st child count for the regular child count stuff, and the CDS kids are showing up on my child count. It is having them in the, the correct settings on there. Are they supposed to be showing up on my child count for that?
They're going to show up on that child count, just because they're entered through Synergy that way. The reason that this spreadsheet is existing is so that we can cross-reference them and remove those students and have that reference. So that's why there's two kind of similar collections that are going simultaneously.
Great. I just wanted to make sure that.
Yep, you're good.
Thank you.
Any other questions?
Sandy, I have a quick question about
Sure.
Child Find. Is there any more discussion or information about what school districts can anticipate regarding Child Find duties over the summer for 2026?
Well, because currently for Muser, Child Find does go through the summer, so school districts should be planning on some sort of coverage for that. We know that typically the Child Find is decreased in the summer, the number of students referred. The only thing is you want to be mindful of students who maybe have been referred during pre-K screenings, that you're, following up on that during the summer. Were you looking for something more specific?
Thank you. I was vaguely recalling, or maybe it was just, I guess I thought there was previous conversation about, potential to explore other options given the contractual restrictions of public schools over the summer months.
Yep. One thing I'll, continue to share is that CDS is a viable resource for that in the summer. And we did that for quite a few school districts last summer that said that they were short-staffed and probably wouldn't have enough people to work during the summer.
And so given that we know the rest of the country has sort of led with public schools, managing this process for a long time, are other public schools throughout the country also doing that, taking on the responsibility of Child Find over the summer as well?
It's done differently in every state. Some states follow a school calendar and some do year round. So those are really the two options. Some have probably some hybrid things maybe as well.
And
Yeah.
so is there sort of like a magic cutoff date where CDS would say, so if a child got referred over the summer of 2025 and my first day of school, I know that I'm responsible for FAPE. And so does the duty for child find continue with CDS prior to if consent was received prior to the first day of school? Is there a magic cutoff date? Because I've heard mixed things about this.
I'm just going to weigh in here. Are you talking before or after you have the FAPE obligation? Because after the FAPE obligation, and part of this is our rule is written for CDS, and we
Right.
haven't made those policy decisions yet in our rule to say
Mhm.
how we're going to handle the summer months. But CDS takes referrals all through the summer, and has been doing that historically. Now, they're probably not as many referrals as happen, because we know that the referrals happen when children start attending school, and then those concerns become more prevalent. But after you receive the FAPE obligation, then during the summer, it would be a referral that you would be handling.
Okay, and so I understand that for a child that moves from one district to another, the way we interpret the rules for kindergarten through grade 12 is that your timeline for completing assessments starts over when they move into your district. Obviously, it's ideal to do it as soon as possible, but your 45 school days for K through 12 starts over. How does that transfer, or does it, for students that maybe were referred and maybe consent was received August 15th, and then our FAPE duty starts, August 28th, first day of school? Does our timeline start over? And
I think how that works, Angela, is that it's not like the timeline starts over. I think the timeline gets extended,
yeah,
and you make your best effort to get it done as soon as you can. But it does mean, understandably, that you're not going to get it done in the 45 calendar days, or
from
actually
dates on
60
consent.
days,
60.
60 calendar days for CDS. Again, because we haven't addressed that in the rule. I've, kind of in my roadshow of Muser, I said, what do people think? And I think that the concern about not doing referrals over the summer is at this age group. Delaying a referral might cost, some services that might be better served more readily, more quickly. So, so a lot of this is our situation where we haven't resolved this yet in
Okay.
our state. So we're mirroring what CDS does, knowing that in the summer things are pretty slow for the 3 to 5, not so much for the infants and toddlers. They keep swinging along 12 months a year. And so if you have accepted the cohort, then you would be, at this point, there's no, factor where CDS would get a referral and sign consent, and then you would follow a timeline because you would be managing that. Or if you contracted with CDS to manage it, they'd be managing it on your behalf.
Yeah, I'm just trying to anticipate conversations during budget season to plan for next fiscal year. So am I hearing you correctly that if CDS obtained signed consent on August 15th, but did not do or August 1st and didn't do the evaluation, it is the duty of the school district to do it thereafter?
I
Are you
think that's
talking
how it
about
works.
now? Like
Yes.
you're dealing with this today, cohort 2, or are you anticipating if you contract with CDS?
No, I'm talking about now. Sorry, two different questions.
Okay,
Okay.
so now if CDS had the signed consent, and when the transfer of FAPE happened, you would have gotten that consent, and then we know the timeline would likely be extended beyond the 60 calendar days, but you would do your best to get the evaluation completed.
So the evaluation is a responsibility of the district.
Yeah,
Okay.
I think there is, someone in CDS tell me, I think there is a date where in the summer where we know that we can't meet the timeline during the summer in CDS, so that we would navigate that with the SAU. to try to see if, I think that's what happened prior to now. Isn't that what happened?
I thought there was like a magic cutoff date. And so that leads me back to summer 2026 question. If there is a magic cutoff date and we have these contractual restrictions with public school and teaching contracts, right? If I'm to lean on my local CDS for evaluations, how does that, if there is this magic cutoff date that I'm vaguely recalling?
Well, the magic cutoff date wouldn't be a thing after you are assuming cohort. So that's off the table. I'm looking, Gail, you're the only one I can see. I'm sorry, I'm going to pick on you. Is there a date after which you're like, listen, we know this is a late referral. We're not going to get it done. We have to work with the school to do that.
Well, you know, what we've done is if there's been consent to evaluate, and even if a child is transitioning into kindergarten, it was still CDS's responsibility to follow through with getting that eval done. So,
but was it true too that potentially CDS didn't have an evaluator and the school did, and they'd say, hey, we'll take care of it. They may even assess a fee to CDS for taking care of that, and they could do that. So those kinds of things happened, which is, you know, Christine, welcome to Maine, the only state that did things like this. But it makes it challenging, right? Because now we have to pay CDS and whatever, or CDS has to pay the, I don't know how that works, but yeah, I think that it's always been kind of, Angela, a problem. And there's no magical date is what I'm hearing.
it's complicated.
Angela, what I would do formally as a director, I would have that conversation with CDS to say, where are you at in the referral process? Has anything happened? Have you made a referral? Is this child now on like a 3-month wait list? If I could get it done sooner, I would do it and then bill CDS for that, because ultimately the goal is to get that done in a timely manner.
Thank you. Yes, we've been in talks of trying to have a meeting to just go through every single kid we know about to verify their status, that the right hand is talking to the left, so that we're clear about what we think to be true.
Absolutely. That is what we would advocate you do if you're in that situation. Yes.
And the other interesting thing that is new for our SAUs is that you are responsible for the initial referral for the C to B transition. And those can happen any time of the year. So that's another factor that has to be factored into this conversation. And again, it's very new for our SAUs to even have to think about that, but it is also something that happens throughout the year.
I think that you can also think about how you approach ESY. Some years I would be begging staff, anybody I could find, to do an ASY program, but maybe in early spring, you could put feelers out to staff who would be available in the summer on an all-call per diem basis, however, to do stuff over the summer. I know it's a struggle with ESY. I'm sure it'll be a struggle with Child Find, but you could look at it that way in some cases.
Lucy, I'm just reading your question. If the CDS provider completed the eval, CDS would pay for it. Yep. And then there's a question about knowing about Part C students who are close to transitioning. You would get a notice from CDS letting you know that there is this child that is getting close, and parents have to give permission, and then we would start the C to B transition.
That starts when they're about 2.5 years old, isn't that right? That you get the notice and
2 years, 6 months, I believe. And please, CDS folks, correct me if I'm wrong. And then the transition conference and meeting would happen at 2.9. Am I getting that right?
Well, it actually 2.3.
2.3, okay.
Is when it can start.
Yes.
And we would always invite the district to that transition conference, which can anywhere between 2.3 and 2.6, or because we want to have an IEP in place by their 3rd birthday.
Right. I will give a plug that Ariana Whiting, who is our Part C director, and myself will be presenting on this at the fall conference. So I will have my dates correct by then. But if any of our special education directors want to come join that training, we will be doing that at MadSec.
You really want to think about the fact that eligibility, all children in Part C are eligible under developmental delay, and that you might not need a complete psychological evaluation to find somebody eligible. So do attend that session to kind of understand what the options are of getting a child on an IEP by 3. That's our logo, IEP by 3.
I want to be mindful of the time. It is now 12 minutes past 4. I want to thank everybody for coming today. If you have additional questions, please feel free to reach out to us. And we thank you for all that you're doing for our children.